It is part of our DNA to take care of our brothers and sisters, to make sure that not only that they get help, but that they know that they are part of a community, a caring community, and importantly, to provide that support and our services and that help with this sense of community and a sense of caring and a sense of dignity. And that's really what the ARC is. So I want to take a moment and thank the food security staff and the entire staff of the ARC for what they do, but also to recognize what we recognize at the ARC, that every day when we come to the ARC, we recognize that what we do is made possible because of people like yourselves who are on this call, your time volunteering, your donations. You are the core supporters that make what we do possible. And really, what we think about every day is that it's really the trust that you place in us that allows us to really make the progress that we've been making in helping the Jewish community. So I want to thank you for being part of the ARC community. Thank you for caring. Thank you for being here. Thank you for taking the time to learn more about this critical issue. And with that, I will turn it over to Marna, Marna Goldwin, our Chief Executive Officer here at the ARC. I believe she's in her 6th year with us. Marna, it's all yours.
Great. Thank you, Len. And I want to echo Len's gratitude to all of you for joining us today and for being really incredible partners in our work. We have extremely dedicated and talented professionals who are working in both of the ARC locations day in, day out, but we wouldn't be able to do this work without your generosity and without your time and your talents as volunteers. We want to hear from you today. So if you have questions that emerge as we go through the program, please click the Q&A button below and submit them. We will address as many as we can after our speakers conclude today, but we really want to hear your thoughts. As Len said, our goal is to give you a deeper look at the challenges our clients are facing right now, how we've been responding during these times, and how we're planning for the future. So I will be joined today by Dr. Jenny Mann Evans, who is our Chief Program Officer, and Ellie Rogers, who manages the floor of our West Rogers Park Market. But before I turn it over to our team on the ground, I want to share some broader context about what is going on in the community and how the ARC has responded over the last 6 months. So just to ground ourselves, Len mentioned a lot of the factors that our clients have been navigating. It has been an incredibly challenging 5 years for Jewish households who are struggling. Navigating through the pandemic, navigating through high inflation, the increases in the cost of living, followed by October 7th, the communal trauma that we have all experienced, and then the continued increase of anti-Semitism locally and globally. For people who are on the edge, there is no break. And for people who are struggling, we also know how common it is for financial distress to create a real emotional toll. It impacts well-being, self-esteem. It can distract from parenting. It can hurt an entire family and household. And we also know our research shows that people may start to distance from the Jewish community when they're struggling financially. Our goal is to ensure that every Jew is able to take steps forward on their path to self-reliance. And we envision a day where we have a thriving Jewish community where no one needs to turn to us in need. But at this time, we have seen tremendous need. So from 2020 to 2025, in these past 5 years, the cost of groceries has gone up by 20%. We all see it and feel it, and it's created a huge burden. Utility costs have also gone up somewhere between 25 and 45%, and with the rising price of oil, we know that's only going to continue. The average rent in the Chicagoland area has risen by 27%. And I just read a recent study that showed that to live comfortably in Chicago, you need to make somewhere between $70,000 and $90,000 a year. But we know that wages have not kept up with the cost of living. And the clients that we serve are really struggling. About 90% of the ARC's clients have income that's at 200% of the federal poverty level. So that is about $32,000 a year for a single person household or $66,000 a year for a 4-person household. That is not enough to make ends meet. So we have seen the toll of these factors, and that has driven to an increase in people coming to the ARC and the usage of services at the ARC. So by last spring, we had been seeing about a 20% increase in the number of clients relying on us for their needs. And just in the last couple of years, we saw about a 50% increase in the number of visits to our pantries. So as of June 30th of 2025, we were taking care of about 1,300 households through our food security program. That's a tremendous, over 3,000 people are relying on us for food assistance. And that is consistent with what's being seen across the Chicagoland area. So according to the Greater Chicagoland Food Depository, it's about 20% of Chicagoland households and 24% of households with children that are experiencing food insecurity. For people experiencing food insecurity, SNAP, the Supplemental Nutrition Assistance Program, is the single most effective anti-hunger program. For many people, it can be the difference between having a level of stability and hitting a crisis. And for the people that the ARC serves in both of our markets, about 70% of our clients and our pantries are enrolled in SNAP. Now, we also have learned through research that it's the government safety net programs like SNAP that are the most influential factor to help people emerge from poverty. And services like the ARCs were really designed to complement government safety net programs. We were never intended to replace them, and we will never be able to. But when our government safety net programs are uncertain, unstable, and starting to wither away, that's where we need to step in. So the legislation that was passed last summer started to make some permanent cuts to the SNAP program. And those cuts have started to be implemented, and we've seen the most recent stage go into effect on February 1st of this year. We've started to see changes to work requirements for able-bodied adults. So those requirements now apply to people who are up to age 64. It used to be people who were 54 years of age. We've also seen it much harder for people to have exemptions when they're taking care of people at home. We've seen new immigrants and certain legal residents who are no longer eligible for SNAP. And we've just seen more and more restrictions, so benefit levels will continue to decline. The cuts are being phased in, and we're already seeing the impact of that. But we happened to get a big preview of what that impact will be last fall when the federal government announced that SNAP benefits were going to be paused on November 1st. And that was a consequence of the government shutdown. When we heard that that was coming, the ARC went into emergency mode because we knew the impact on our clients was going to be drastic. We were able to calculate what the impact was to clients just to lose 1 month of SNAP benefits. Our clients in total could have lost somewhere between $200,000 and $300,000. So that's the magnitude of the reliance that people have on their food assistance programs. So when that shutdown happened, the ARC moved quickly, and we are so grateful for all of you who joined us in that effort. Together with our teams, we were able to start to extend emergency packages. And we were ready to go into emergency mode because of a lot of the building blocks that had been put in place in these years before. Our West Rogers Park Pantry is now operating as our new grocery store style market in our new building. And that pantry is 4 times the size that it was before we moved out in 2022. We had also made tremendous investments in infrastructure. We had a better inventory tracking system. We had an online marketplace, and you can see a little visual on the screen of what it's like to shop online in our pantry. And these technology and infrastructure enhancements, I want to also thank the Sensor Family Foundation, who made these kinds of investments in the ARC, and we are seeing the benefit of it now as we are able to really scale to meet the growing need. So with more streamlined logistics, better purchasing, and new corporate partnerships, we've been able to hire an inventory specialist who helps now oversee our supply chain and logistics. We've also expanded our team of dedicated pantry volunteers who have helped support this response, both in our Northbrook and West Rogers Park markets. So our renovated pantry, the grocery shopping experience, and the tremendous support of our staff and volunteers have made it so much easier for clients to ask for help and get the help they need. I want to really thank the people who made those investments possible, and it made it possible for us to deploy our emergency response back in November. So when SNAP was disrupted, the ARC went into action, and we were able to distribute over 600 additional packages of food that got out into the hands of our clients. They were filled with essential items, food, as well as household goods to supplement clients' pantry orders. We extended this through the full month of pantry because we knew how hard our clients were being hit. The impact was incredibly profound. Our staff and our volunteers heard so many stories of gratitude from clients who were so moved by the additional assistance. Clients didn't even have to ask, and when they saw that the ARC was stepping in to meet that need, they felt the tremendous support of this entire community. So we have continued on. As SNAP came back, we continued to expand our capacity. We've added 10% more appointments, both in Chicago and Northbrook. We're continuing to make investments in logistics and technology, and we're continuing to ensure that we will be able to scale our services to meet the growing needs. I am really proud and grateful to how our teams responded in these hours, and it made a tremendous difference. Over the last 8 months, we've seen 25% more people come to volunteer in our pantries, stocking shelves, helping us with inventory, delivering food to clients who are homebound, sorting collection items, and really being out on the ground collecting food to help us keep our shelves stocked. The community also stepped up by increasing financial support for the ARC and for our food security program. When we reached out on October 31st to share the impact of the SNAP pause, we saw hundreds of people respond. In total, we had 320 donors make gifts that totaled almost $370,000. This included special grants from JUF, from key foundation partners, and it included hundreds of individual gifts of all sizes. People wanted to help, and we are so inspired by the generosity of this community and the impact that we can all have when we work together. Now, while what we experienced last fall was truly an emergency, and thankfully it was temporary, those program changes are beginning to phase in. So our priority now is to be working with our clients and make sure that they can remain as a part of the SNAP program. We want them to retain their eligibility, achieve their maximum level of benefits. Our case managers and our frontline staff are working incredibly hard to provide that level of care for clients, and Jenny will share more about that in a few minutes. But we also need to make continued investments in the food security program. We have more people to feed. We need to ensure more access to food and household essentials, and we have to have the systems and the logistical support to get these items into our clients' homes. We are so grateful for our partners with companies and organizations who are helping us access both discounted and donated food. We are always looking to grow this level of support, so if you know people who work in the food security industry who work in distribution, please help us access more kosher food, more personal care items, and more household essentials. We would love to talk to them. So as we continue to evolve to meet the changing times, we are also committed to retaining the essence of the Ark. What has been true to our approach since we opened in 1971 is the care and dignity that are a part of every client interaction. I see it in our pantries every day through professionalism, kindness, client choice, agency, and respect. And I'm really excited to introduce one of our pantry managers who makes every client feel welcome and comfortable. So now I want to turn it over to Ellie Rogers, who is our food security manager for the West Rogers Park Pantry. Ellie's background in Jewish studies and the sociology of nonprofit organizations has prepared her well to care for our Jewish community here. She's on the ground with clients and volunteers every day and will now share what she sees in the Ark.
Thank you so much, Marna. Hi, everyone. I'm so happy to be here speaking with you today. I want to explain a little about the impacts of the SNAP legislation on the pantry, how that impacted me and our volunteers and our clients as well. As Marna said, a reality for many in the month of November was pulling up to the grocery store cashier with a cart full of groceries and swiping an empty EBT card with no money on it. So this is one of many reasons over 2,100 people came to the ARC pantries in the month of November 2025. Since July 1st of last year, our pantries have served 3,141 individuals. And in the entire previous year, we served 3,043 individuals. So just in these past 8 months, we've already surpassed the number of clients we served in the past 12 months before that. So we've just compressed it all into these 8 months to do everything we can to support our clients. For me, as the food security manager, November was the busiest month I had ever seen at the ARC in my 3 years there. Every appointment, every day for weeks was completely filled. It was really a testament to the need in the community. It became very apparent to myself, to our volunteers, to our staff, that our food pantry has grown from a food pantry to a small scale grocery store. We have multiple locations. We have set inventory. We have distribution standards. So this growth required, a lot more support. The challenge was balancing the logistics of running a food pantry with the needs of the community, given the set amount of community support that we have, which we're so grateful for. But working within those boundaries, more clients means more people the ARC can help, but it also means more inventory to acquire, more individual needs to address, regarding specific dietary restraints or kashrut standards, or simply preferences. And all of that requires more manpower to make it all happen. Speaking of which, our volunteer team, as Marna stated, has been incredible, especially during that really busy month of November. I think the volunteers felt the stress that our clients were under. They listened to clients open up. Some clients who hadn't opened up before, who maybe weren't vulnerable in our space the way they had been before, because that was the truth of their emotion. So our volunteers served client after client with compassion and such a listening ear. Even more so when I sent out an email to our volunteers asking for more help, asking for additional people every shift, the response was so immediate. I'm the only staff member on the floor when the ARC Market is open in Chicago. Everything else is done by our volunteers. So without their support, always, but especially that month, we would not be able to have accomplished what we did. And it's because of that and because of the power of community that we were able to create and distribute hundreds of these supplemental packages. These packages included food, They included non-food essentials, and they were given alongside the client's pantry order. So in addition to all of the items the client typically ordered, they received this supplemental package with household staples, rice, beans, tuna, but also things that weren't covered by SNAP benefits to provide some relief in their budget. Toilet paper, toothpaste, floss, other personal care essentials that everybody needs. And the response when receiving these packages was so great. One client, she has 4 children, I remember this. She said, I didn't expect to not have this money. Over $200. We couldn't budget for that. It was $200 she expected to have in her bank account, and it wasn't there. Another client told me he didn't see the notice. He didn't receive the notice about receiving an additional package. So he gets all of his items from the pantry and he goes home and calls me right away, immediately. He says, Ellie, I'm so sorry. I took a bag that wasn't mine. I don't remember ordering these items. I feel terrible. I'll bring it back right away. I want to take it from someone who needs it more than me. And it made me smile because it was such a blessing to be able to tell this man, you don't need to return anything. This is a package from the ARC to supplement this pause in SNAP distribution, and we hope it helps. And to hear his relief in that moment was such a special thing. I think this showed me, it showed all of the ARC community and those who don't know the ARC clients, that even in the face of poverty or hunger, our clients still have compassion for others. Poverty and hunger are not indicative of those things. Gratitude is not a statistic that our data management team measures, but if it were, I think it would have increased tenfold in the past 6 months. I mean, every client in the past few months has left the pantry with a big thank you, or sometimes some other deep, recognition. One quote that I want to share that was shared with me was a deep recognition such as that. This client said, if I had money like I used to, I would donate generously to the ARC. Everyone I've talked to is so amazing. You don't see these people in normal life. It's everyone. I'm searching for the right word to use. Mishpacha. That's what the ARC is. This mishpacha is Hebrew for family, for those who don't know. It was really impactful to receive those words from that client and to hear firsthand what the work we were doing had an effect on, and to hear all this feedback and this gratitude. It was so recognized by the people we're serving. I mentioned that the ARC pantry served over 2,100 individuals in November. And I'm sure we have some pantry volunteers in the crowd here. I think you guys can attest to the fact that, even in the following months, December through February, we've served even more individuals. In fact, we've served almost 2,200 individuals. And that's after the SNAP distribution pause was lifted. This is everything since then. And so when the One Big Beautiful Bill was put into legislation on February 1st, I think we're only going to see those numbers rise. The data that we've shown so far has shown us that. So we have increased our appointments by 10% to make sure we can accommodate that. And the ARC food security team is really committed to doing all we can for our clients. We're so lucky to have such an amazing team of volunteers, over 70 volunteers putting in hours every week to make this a reality. And it was because of them really that we were able to provide all these supplemental assistance to help in the wake of such a crisis. Thank you, guys.
Thank you, Ellie. Thank you so much for all that you do every day. We are so lucky to have you as a part of our team at the ARC. And now I want to introduce our next speaker, who is newer to our team at the ARC. So Dr. Jenny Mann Evans is our Chief Program Officer here. And she joined us about a year ago, but as she likes to say, she got her start at the ARC about 25 years ago doing her mitzvah project. Jenny is an LCSW. She has a master's of social service administration from the University of Chicago and a PhD in social work from the University of Illinois in Urbana-Champaign. So Jenny, welcome.
Hi, thank you everyone so much for being here to hear about such an important topic and how we're meeting the moment here at the ARC. For many people, the ARC food pantry is an entry point, not only for clients, but that's also for volunteers like me and my own children. Here in this picture is me when I was, I think, 10 or 11 years old, bringing food to the ARC after a family sukkah party. And then the picture on the right is my son, Ari, at 5 years old, this past Sukkot, when we had our very own food drive for our family sukkah party that I'm now hosting. And so I just think that it's such a great example of how this entry point of food pantry really brings in anyone, whether it's a volunteer or a client or anyone who's looking to be involved at the ARC. Today, in my role as Chief Program Officer, I oversee all of the ARC's client-facing programs. As many of you know, we don't only assist with food security, but thanks to the generosity of our community, we also provide financial counseling, employment support, housing resources, direct access to free and medical dental services here in our building. We provide access to psychiatry here, navigation and access to mental health therapy, supports for people with ongoing mental health challenges, as well as opportunities for Jewish enrichment. So today I'm going to share some insight into how food assistance is not only a vital component of supporting our clients' overall well-being, but it's also an entry point into that wide array of services that the ARC can offer economically vulnerable members of our community. And we do that through a really transformational process that's more than a transaction of food to homes. So for many clients, food insecurity is the presenting issue when they first come to us. So when people call our intake line, they're in need of food. Increasingly, as SNAP cuts, as Ellie mentioned, SNAP cuts are creating a sense of instability for people relating to food. That's the primary issue they come seeking. So in terms of the amount, since July, almost 60% of our new intake requests were for pantry services, which is up 18% from the year before. People are calling for other issues like housing, employment, mental health. There's still huge challenges for those who are vulnerable, but the prevalence of issues related to food has definitely spiked as concerns around SNAP have also risen. But as we think about food security here at the ARC, we know that it's more than putting food on the table. It's one specific intervention that's part of a holistic plan that supports a client in their overall household well-being and economic stability. It's almost never in a vacuum. We're also addressing a whole other host of root issues, from health, employment, budgeting, financial management, to housing instability and more. And that's part of what makes the ARC model truly unique. We integrate a huge breadth of services with deep personal care coordination that's really uncommon in our field, this really deep relational component that the case managers and other staff have with the client. And as Ellie mentioned, it's profoundly impactful on our clients. For example, food security is one measure of our clients' overall well-being, and addressing food security, how that works as in their path to self-reliance. So one specific component of our approach is particularly important here, and that's financial education and financial counseling. Every personal care plan at the ARC is rooted in helping clients think about how to maximize their income and balance their household budget. It's much more than just groceries and household goods. This is an integral part of ensuring that clients aren't just given the resources to navigate an immediate moment of crisis, but also increase their potential for long-term self-reliance. In this context, the food pantry is actually an important economic tool. Our case managers help clients consider how can receiving food from the ARC also support other important parts of their household budget. For instance, if food pantry saves you X amount per month, where can you best use those savings? And they really work to personalize a care plan for that individual in that household. For example, clients participating in our 18-month housing subsidy program receive a subsidy of up to 20% of monthly housing expenses, up to $1,000 a month. One requirement for all participants of this support service is to use the pantry at a minimum of 8 times a year. The reason we do that is so that our housing team can help them contextualize the food they're receiving from the ARC within their overall economic situation and think about their food budget, housing budget, and other key expenses in relation to each other. In other words, if they're coming to us for the food that we can receive at lower prices, then they have that relief from their household budget to use on other things, including all of the social determinants of health. Ultimately, our goal is to help build good financial habits that create a mindset that'll help clients and households truly advance toward economic stability. One example that we have of someone using all of these wraparound services is a client who started with case management and food. Food was his entry point. During that time that he was coming to the ARC, he had lost housing due to unemployment. Our housing department was quick to help get him into a hotel to stabilize that crisis. They continued to work with him diligently. They worked with the financial counselor and also with our employment department. He ended up with all of those skills, landing a great job. He's now eligible and recently moved into one of our new beginnings apartments, which is an apartment that this individual can live in without paying rent, but they make small contributions to a trust each month. And at the end, we're able to give that amount of money toward first and last month's rent, toward a down payment, whatever it is they choose to do. And he's on a true path to self-reliance. And food was his entry. And it's continued to be. He continues to come to our food pantry each month and is also looking at ways to build groceries into his budget now that he has some liquid assets that he didn't have prior to coming to the ARC. So growing food insecurity in our community makes this integrated approach to client services even more important. So let's return to the moment. As food insecurity grows in prevalence and severity with recent changes to SNAP, we're also feeling an even greater urgency to evolve our model of client care to ensure that we're addressing clients' most urgent needs in a truly integrated way. One of my biggest goals since joining the ARC's team almost a year ago has been integrating all of our client service departments. The ARC has an unusually broad array of programs, which I mentioned earlier, and that's grown organically over the last 55 years in response to our community needs. It started as a medical clinic and later added food security and later added housing, and it's really evolved over time, meeting the moment for what our Jewish community needs to address economic vulnerability. So over the past year, we've really started to integrate and align these programs into 2 key service areas, service teams that help us think holistically about our clients' needs. One of those is economic stability, and one of those is physical and mental well-being, all of which encompass the social determinants of health. Across these teams, we're looking at 5 domains that are indicators of self-reliance, which are income, employment, physical and mental health care and access to physical and mental health care, food, and housing. So starting this summer, we're going to begin updating personalized care plans that we're going to be creating for each of these 5 domains. Case managers will be working with every client to develop goals in each area, which will be set collaboratively with the client and reviewed every 6 months. They do this now, coordinating care with internal specialists, including our health clinic, mental health programs, employment, housing, financial counseling, food security. And then they'll also be able to make outside referrals and track the progress over time. So the process of collaborative goal setting and those regular 6-month check-ins will deepen the partnership between clients and case managers and bolster the strength-based client-centered care that's always been at the heart of our work. We're also doing some real training around things like motivational interviewing and things that the research shows helps people in real behavioral change. So with this model in mind, we've also created a self-reliance index to track clients' progress. So using a 1 to 5 scale for each domain, it will help us track where clients are progressing, where they might be stuck, and it'll also give us a real understanding of the outcomes for our work with each client individually and in the aggregate. So right now we can see like how many food pantry visits someone has a year. But now with this way that we're going to track with care plans, we'll actually be able to see quantitatively someone moving on their path to self-reliance. So ultimately, we want to measure the progress and evolve our services to better meet those most urgent needs and emerging needs of our community, which we've been doing for the last 55 years. While we're evolving our approach to care coordination and integrating services, we're also looking at how we can invest in key areas that allow us to do even more for our clients. In January, we launched a new eligibility team, and we're looking at our intake and eligibility structure to take care of some of the regular record keeping off the plates of our case managers and allow us to keep better ongoing track of details of clients' financial situations and better tailor our services, both at the beginning of the client relationship and throughout their life cycle at the ARC. We're also starting the process of hiring a full-time benefits navigator who will work with clients to access benefits like SNAP, Medicaid, housing support, and other federal, state, and local programs that they're eligible for. These programs have become increasingly difficult to access, and they involve things like 6-month redeterminations and a really burdensome amount of paperwork that are really difficult for clients and anyone to really keep up with. So the work has been historically done by our case managers, but the vast number of programs and the increasingly rapid pace of change has made it hard to keep up. There's been changes in work requirements, there's changes in eligibility, there's changes in the mechanisms for which people apply. So having internal specialists who can help clients navigate these benefits or connect them with partner agencies that may have really excellent programs for accessing these services will help ensure that clients are receiving all of the benefits that they're entitled to. It'll also let us use the ARC resources to complement government programs and use funds in the most impactful way for our clients. As Marna mentioned earlier, we also have continued plans to strengthen our food security program. Our amazing team, like Ellie, are working to build new partnerships, both with other agencies and with food companies and other private partners, to secure more food at lower cost to the ARC. We're also continuing to strengthen our inventory process and the operations of our warehouse and 2 food pantry locations in West Rogers Park and Northbrook to expand the number of people that we're serving. We also know that geography is still a major barrier to accessing all of our services, and especially things like food, which require people to pick up physical items. We're in the process of exploring some really exciting potential strategies for making ARC services more accessible to our community, especially out in the suburbs where potential clients can be spread out across large areas and may have difficulty getting to our locations. Options for smart partners with other organizations and a platform for mobile services are a couple directions we're starting to think through what that would really look like. At a more detailed level, we're also looking at the amount of food and household items we're providing to clients through our pantries to make sure that we're doing enough in this arena to support their dignity and well-being. All of these considerations are ultimately geared toward allowing us to truly meet our community's needs in a way that are deeply personal and really move clients forward on that path toward self-reliance, whatever that may look like for each individual who turns to us for support. That's really the magic of the ARC, and it's really what's been the magic of the ARC and what we'll continue to prioritize as the scale and shape of our economic vulnerability in our Chicagoland Jewish community evolves and changes over time. So with that, I'm going to pass it back to Marna to summarize where we are in this moment, and feel free to put any of those questions in that Q&A, and we're happy to answer at the end.
Thank you, Jenny. And I want to please submit your questions. I do want to take time to address them. But as you can hear, we are just at the beginning of this journey. We are projecting that we will be touching the lives of over 5,500 people this year who are turning to the ARC. And as you heard, food security, it's not just a food issue. there's an economic stability issue, and with continuing cuts, inflation, upcoming changes to the safety net programs, and other complications, we anticipate even greater needs. We know that the number of people using our pantries will continue to grow, and we're continuing to increase our budget so that we can meet that demand. So this year, our pantry budget was over $800,000, and over half of it is for the actual purchase of food and household items to keep our pantry stocked. That's about a 45% increase over last year. So we are meeting the growing need. We are becoming more efficient. We are engaging the community even more to help us manage those costs. And we are relying on you all and our volunteers to continue to serve all of our families. The more that you can do to partner with the ARC, the more we can prevent our families from falling into a deeper crisis as the conditions change around us. I want to take a minute to address a couple of the questions that have come in. And one question specifically asked how the ARC's pantry is going to be meeting the needs of the community during Passover. And I appreciate that question, as our sites are focused on our upcoming holidays. So the ARC ensures that our clients have food, kosher for Passover food. And I'm going to turn it to Ellie in a second to share a little bit about how the pantries are transitioning. In addition to what our pantries are doing for Passover, we do ensure that clients can celebrate the holiday. So we will be hosting clients in a pre-Passover Seder here as a part of our Cafe Arc program. And we will also be ensuring that clients can access the Seder in the community itself. Our clients also are participating in the Ma'ot Chitim program. So we have a lovely partnership with Ma'ot Chitim where clients will receive Passover food right before, I think it's actually the Sunday, where we'll be out delivering. But Ellie, I'm going to ask you to share a little bit about how we're getting ready for Passover in the pantry.
Of course, what a wonderful question. So our clients are fortunate to receive the Ma'ot Chitim package, many of which also receive goods from the ARC pantry for Pesach as well, in addition to their Ma'ot Chitim package. We offer during the couple weeks leading up to Pesach matzo ball soup mix, jelly, macaroons, all things that are kosher for Pesach. A lot of our typical pantry items are kosher for Pesach as well. Our cheeses are kosher for Pesach. All of our meats are kosher for Pesach. Olive oil, quinoa, other household essentials like that we've made sure are kosher for Pesach. In terms of ridding the pantry of chametz, we actually got approval from the CRC, the Chicago Rabbinical Council, last year because our office is closed not only on Pesach but Erev Pesach and the day after Pesach. We actually don't need to remove the chametz from the facility as long as we have everything notated, whether it is kosher for Pesach or is not. So clients who do choose to keep kosher for Passover will have the option to get everything they need for that. And then any client who does not choose to keep kosher for Passover, they will be able to receive other goods up until we close for Pesach. Hope that answers the question.
Great. Thank you. Our next question is about the work requirements that are going into place. So Jenny, why don't you share that one?
Yeah, so we're really educating ourselves all across the client-facing teams between case management, our employment services, and also our non-client-facing teams, our volunteer and outreach department, to really partner on and becoming experts on what those work requirements are, what the exceptions are. We're learning how to fill out the exemption forms with and on behalf of clients. And we're also collectively attending a training next week through the Greater Chicagoland Food Depository on how to navigate those benefits as well as those work requirements. So we're really partnering across the entire organization to help folks navigate this really complex system. And not just complex, but ever changing.
Great. And I also, I'm really grateful for the work of JUF and the TOVE Community Network for being so proactive and thinking about how agencies can be working together to navigate all the changes in the government safety net programs, but also in particular helping people access volunteer programs across the community and ensure that they can meet those requirements through our collective network of agencies. Okay. Let me see if we have any other questions. I know we had a question about parking spaces. As a volunteer, we acknowledge it can be a challenge to come to the Ark in West Rogers Park. Fortunately, our Northbrook pantry does not have the same challenge in accessing parking, so that could be a great place to volunteer. I wish I had a great answer to the question of could we get more empty parking spaces, but I would say come early, and fortunately our neighborhood does have some nice parking availability, and one day we dream of parking not being the biggest challenge people face when they're volunteering at the Ark. Okay, there was another question. Outside of donations of money or good, how can more localized Jewish populations throughout the Chicagoland area support the work that the Ark does to raise the standard of living for those that it serves? That's an excellent question. So I want to share a little bit about the Ark. So we are part of a network of Jewish human service agencies that is a national organization that's working to address, the needs that human service organizations face. And we also partner with human services agencies that are not part of the Jewish community. So together we try to advocate for programs and opportunities that would help our clients access more resources, help them navigate the challenges that they're facing. And really, we'd love more opportunities to get our clients engaged in asset building opportunities, whether it's employment opportunities, educational opportunities. I mean, the research shows that it is education and employment that really are the two factors that help people emerge from economic vulnerability. And so anything we can do to help people with their economic stability and address that standard of living, we would love the partnership. All right, and then I think there is another question. Jenny, if you can take the next one.
Sure. There was a question, a really great question about it says, will the integration of the care coordination services include other community programs people also need to understand the complete scope of need? The answer is yes, where we have really active and great partnerships and working relationships with places like Midwest Refuah, who offers all sorts of things with physical and mental health and well-being. We have a working relationship with Shalva, who helps folks with domestic violence and navigating those systems. We also had a really, I think, very impressive project that we're still working on with Upward, where the Ark assisted them in getting their Medicaid credentialing, which is going to help our folks who need mental health services access culturally competent mental health services. And so we're continuing to strengthen those partnerships, and we look forward to doing more of that.
Great. Thank you. Another question came in about how many of our current clients are likely to lose their SNAP benefits. Unfortunately, we don't have an exact statistic to address that. We are working with our clients now to ensure that their eligibility is solid. And Jenny, do you want to talk about how our case managers are working really closely to ensure clients don't lose their SNAP benefits, and when they are, how we're trying to get people back on the system?
Yeah, absolutely. So we have, when people place their pantry orders in that great digitized system that Marna mentioned earlier, people will indicate whether or not they're receiving SNAP. And so case managers can see really as close to real time as possible if someone was previously on SNAP, has gotten off of SNAP. And so they can see that, and they can talk with the client about what's happened and why they've lost their SNAP benefits. And then if it's an issue of needing assistance with redetermination, we can help them do that. And then if it's an issue of they just have lost them, there's people who don't even know why they've been taken off SNAP on a given month. We can look at their points and we can see, do we need to, we work on a point system. Basically, we can offer them a little bit more food. And so that's the best way to say that. So whether we can help them get back on SNAP, whether we can give them some extra groceries, we can do either one. So, and we're continuing to increase our capacity for how we help folks navigate things like SNAP and Medicaid and working on that.
Great. Thank you. So we've shared a little bit about what you can do to continue to be great partners in this work. And I encourage those of you who have not had a chance to be on the ground in our markets, both in Northbrook and West Rogers Park, please come in, see how we are addressing food and security needs in the market. And if you have been here, bring friends and family. The more people who know about the ARC services, the more we can ensure that anyone who is in need will learn more about the ARC through word of mouth. We also greatly appreciate your continued financial support and all the ways you support our work. And for those who like to be on the ground in our collection efforts and keeping those shelves stocked in the pantry, I'm currently running a tuna drive. So if you are thinking about how could I actually stock the shelf myself, please bring tuna. I'm trying to collect 5,000 cans of tuna for our pantries. So I encourage you to join the tuna drive. And I also encourage you to sign up to volunteer. We have plenty of opportunities, not just in our pantries, but across the whole ARC, and would love to have you lend your talents, your time, and your wisdom and your heart to our work. So as we talked a little bit about Passover, I want to just remind us of what do we proclaim when we sit at the Seder table together? Let all who are hungry come and eat. Our Torah and our tradition are unequivocal. We're commanded to open up our hands and to give enough to meet real needs. And we are commanded to do that with compassion and dignity. And that is what the ARC was founded upon 55 years ago and what continues to anchor us in our work. Our goal is to ensure that every Jew in this community has access to food, support, connection, and all with the most dignity. We will continue to be at the forefront of efforts to collect, to organize, to grow, and distribute resources for food, but we will really be at the forefront of ensuring that every Jew in this community feels taken care of, has enough food on their table, has a safe place to sleep, and remains connected to the beauty of what our Jewish community can offer. So I want to thank you for ensuring that we can fulfill this mission. Thank you for being great partners in our work. Thank you for standing with us in this mission, and I hope you have a happy Passover, Chag Sameach, Chag Pesach, Kasher v'Sameach, and look forward to continuing to partner with you in the future.